NetsChat. Hey guys, welcome back to another episode of NetsChat. We are at episode 5 in our Sex Miseducation series. Love seeing the feedback so far. I'm really enjoying that you guys are learning from this series because you know that's what we're all about. Practicing and promoting safer sex and sex education that we didn't learn in school and we didn't learn from our parents because you know the stigma around talking about sex overall is very taboo. So, you know, glad to see that you guys are enjoying it. And today we will be talking about contraceptives. And who better to talk about contraceptives than a pharmacist, aka or pharmacy intern, Jo-Nelle. Hey, Jo-Nelle, welcome to the pod.
Thank you for having me. Hi, guys.
You can just give them a short introduction, tell them, you know, who you are, what you do.
Yeah.
Yeah.
So, guys, basically, I'm a pharmacy intern currently. So I have a year of internship so that I'm completing that right now. And then after internship, then you have like a major exam and then you become licensed.
Oh.
So I'm finished with school, but I'm just on the 1 year internship program.
Nice. Love to see it. So as a pharmacist, I know that, but the first thing I want to ask is, as a woman, I really wanted to have a woman on it because I was saying that usually when you go to the pharmacy, it's really hard to get a non-judgmental pharmacist.
That's true.
So like when you go and you ask for like contraceptives, you know, the emergency one, like your plan B and stuff, they always like give you a side eye. And when they give you the counseling or the talk, it just feels like they're judging you. I've had my fair share of judgment. And I don't even take birth control for, you know, the sexual reasons. I take it for hormonal reasons. And I just feel like, because you don't know why people are taking something, you just shouldn't, judgment shouldn't be the first thing, you know, you cast on and, you know, you're talking down to them. And I've seen a lot of tweets on Twitter and, you know, a lot of people recounting their experience with pharmacists. And I just want to say, are you one of those, I'm just asking like straight up, are you one of those pharmacists or have you seen or experienced something like that before?
All right. For me personally, I've never seen it. I know that persons might encounter it as these tweets online. Now, you know, you're surprised when you hear certain stories, but I've worked in pharmacies. I've never seen the judgmental side of it where people might side eye. I know that it does happen. It's true that it does happen because, you know, everybody has their own personal biases and whatever, but I've personally not seen it. And I don't hope to, like, when I practice, I become one of those. But I do have to say that as pharmacists, you do have to be judgmental, but you don't have to be judgy, if you get me in a essence, because we do have to make judgment calls daily. You understand? Okay, whether it is to save a person's life, whether it's to make sure that your patient is taking something effectively. So, So we do have to make judgment calls, but that doesn't necessarily mean that you have to be judgy or judging persons. Because I just said, people take birth control for numerous reasons.
Okay. Yeah. So that leads to the first question. What are the different types of contraceptives, you know, available? Because I know it's more than just the birth control. So All right.
So basically, all of them are birth control because all of them are controlling birth, where you have specifics. So, but the thing is, when people say birth control, they're really referring to the pill. But it's not the only birth control. You have your condoms, whether it's male or female. You have your intrauterine devices, which is the IUD. You have an implant, which is usually implanted in your arm. You also have your cervical cups, your diaphragms. You missing anything? And you also have your injections, which you know as your Depo-Provera.
Who's that? I think I watched that episode of a cartoon. I think it was Rick and Morty. I don't remember when the daughter was probably like having sex and there was like a dating show, like when you watch The Bachelor or The Bachelorette and you see the people come out. So it was a different type of contraceptives and she had to choose which one was best for her. So how does one go about choosing the best contraceptive for them?
Okay. So, you know, like people might ask, what is the best contraceptive? You can't really off the bat say, oh, this is the best contraceptive because everybody's lifestyle is different. Everybody's body is different. So it's basically picking and choosing. You basically just start at one. And then if that doesn't work for you, you switch and try something else. So there's no best per se. But each of them have their own like effectiveness. They have their own like positives and cons. Understand? So you just have to try. And then if that don't work, you just try something else.
So it's okay, then
so there isn't So there's no specific to say, okay, this is better than which, because in reality, all of them probably can fail.
Nobody want to hear that.
Nobody, but you know, but and I said that too, is basically if you don't take it or you don't use it properly as well, that can make it fail. So even like your condoms might be burst, right?
Mm-hmm.
So, you know, there isn't one to say, oh, this will 100%. There's none.
That's 100%.
Apart from abstinence, there's literally none to say, you know?
Guys, you heard it here first. If you don't want to have a kid, abstain. If you don't want to get anything, abstain as well.
It's the only one that is literally 100%.
100% because you're not doing anything. So what are like the common side effects of taking birth control? You know, if you decide that you're going to take it, what are some of the common ones? I know like you being like moody and okay, moody.
All right. So repeat the question again, please.
The common side effects of birth
control. The common side effects. All right. So you know when like people be like, oh, I don't want to put hormones in my body. And then because birth control, they usually have hormones like your pill, or if you're wearing the IUD, use the IUD or the implant. But the thing is, our bodies naturally produce these hormones. It's just that we're putting the synthetic forms of these hormones, the estrogen or the progesterone, in our bodies. So, repeat the question again. I got that's my train of thought.
The common side effects.
The common side effects. Okay, so basically, when you're taking these synthetic hormones in your body, right, they can cause weight gain, can cause nausea, they can cause vomiting, they can also cause spotting, which is basically bleeding not related to your pregnancy.
Okay.
But not all of them per se will cause those effects, or if you take it, it's not, I said that it's going to happen. It might happen, but it don't have to happen.
Okay, so when I don't understand why people would think that they don't want to put the additional hormones, which sometimes I understand it can be good for you because some people don't produce enough.
Exactly.
So when they do take it, it really kind of balances it out.
Yeah.
And so another question is that when you take like these birth control, especially like the pills, can it, stop your menstrual cycle, or can it like throw it off, or just cause it to happen?
All right. So as I said before, you have persons who their menstrual cycle is not regulated. So they might have the period coming now, few months it doesn't come, then the next month it might come, right? So what the hormones are doing, they're producing or providing a steady concentration of the progesterone and estrogen. So because you're basically providing that constant concentration, it helps you to regulate your period. So whenever you stop taking it, for example, the pill, I should say, whenever you stop taking it, that's when you start to have your period. Let's say specifically on the pill, because as I say, it depends on each one of them have their own mechanism of action or how they work. So let's say the pill, right? You have like a 28-day pack and you have a 21-day pack, right? So the 21-day pack, when you take one pill each day at the same time, you see after the 21 days pass, you won't have your period. As in, during that 21 days, you don't have your period. When you stop that 21 now, you have 7 days break. And during that 7 days, that's when you have your period. You understand? The 28-day pack now, it has 28 pills, and you take one pill each day. So if you take the one, so the first 21, they have the hormones. And then the last 7, they're just like sugar pills, or they contain like iron to help supplement you when you're on your period, because you lose iron when you're on your period. So even though you're taking 28 pills, those 7 last ones, as I said, they don't have anything. They just have like the iron or the sugar tablet.
Rejuvenate your
so
body when
during that 7 days when you take it, you're going to have your period. Yeah, those last 7 days.
Oh, I've never heard of like 28-day packs though. I've always used the 21, and I'm like,
so the Yaz is an example of a 28-day pack.
Oh,
yeah. So some persons now, while they're on the pill, they might not want to have the period on at all. So what some persons might do is like, once the 21 days done, they just start a new pack. Or once the first 21 of the 28-day packs finish, they just start a new pack, so they don't have a period on at all.
So so what I'm guessing is if you continue like just taking the hormones, then it can make your period just
stop. Yes.
Okay, so Quick
That is with the
question.
pill.
Yeah, the pill. I'm talking the pill specifically.
Right, no, yeah.
So what if like I'm on my period already and it's like second day out here or the third day, I'm just came out of some period again. I can't continue, I can't take the pills and it just stop it?
No, it won't stop because remember I said the endometrium, the wall of the uterus, already come off. So all that is just going to come out of your body. If you understand. Because it already break down and peel off at the line of the womb, so it will just flow and leave.
Oh, because I've heard stories of women's period come and they want to stop it because, you know, they have plans. So they're like, what can I do to, you know, eat like delayed, make it start, even stop for like a day or a couple hours.
If I'm correct, I know some people drink a lot of lemon water, I think, to stop it or probably delay it. Some people say it work, but you know, it's not a sure thing to say, okay, this will delay my period. But one thing as well, you know, like you have like your safe period. You ever heard of that? So usually, you never heard of safe period before?
No.
All right, so usually, your safe period is usually 5 days after or 5 days before you have sex. It might vary for persons. So people are saying, so if you know that your period might come, let's say tomorrow, and you have sex the day before, right? You're basically in your safe period, so you won't become pregnant because...
Oh, those periods. I heard about it after.
Yeah.
Okay. Not bad.
Yeah, because remember that the reason why you're basically safe to say is because the wall of the uterus already start to come off, you know, or break down. So it's just that during that period, 5 days before, your uterus lining already start come off because the egg did fertilize, you understand?
Okay.
So it already start to come off, and so you're going to have your menses. So you'd be safe per se within that period.
Okay. So talking about like birth controls now, like pills specifically, because I don't know a lot of people who take like, you know, IUD, and I know a few people who take the injection. But I don't know anybody who take the patch and stuff. But so somebody asking on Instagram is, can birth control make you unable to get pregnant in the future when you're ready to have kids? It can.
All right, so basically, no, I would just say to you, but none of them, none of the hormonal birth controls that you know of, none of them can cause infertility. The only thing is that if you're on the Depo-Provera, right, it may take up to 12 to 14 weeks for your body to go back normal for you to start be able to get pregnant again. So none of them cause infertility, just to be clear, none of them. It's always reversible unless you did cut your tubes.
Okay.
Yeah.
That's good. So
yeah, so none of them cause infertility, and that's just to be clear.
Okay, so how long is like too long to be taking birth control? Because somebody said that she was taking it for 7 years, and she wants to know if that's like a long period of time or
You can take it as long as you want,
so
because it's not harmful. Because think about it, if it was something harmful to be causing like cancer or fibroids, we wouldn't be telling the person to be taking this into their body.
Oh, that was a comment, you know, because somebody said she heard that birth control pills causes fibroids. So can we just clear that up for a quick second?
Yeah, so to clear back before you can be on the pill as long as you want to. It's up to you whether you want to come off. So when you decide to, okay, I'm meant to come off the pill now, it might take up to like 2 weeks or more for you to get back, your body to get back normal, and you can try to get pregnant again. So yeah.
No, but does it cause fibroids?
No, so it doesn't cause fibroids. It doesn't cause endometriosis. In fact, it actually helps with those. Because, so you see, when you have like fibroids and endometriosis, it causes you to have like painful period or cramping, right? So how a mechanism of action of the oral contraceptives, not even oral, like your patch, your IUD, the oral contraceptives, the implant, how they work is that they thin the lining of the lining of the uterus, the endometrium. So because it's thin, and you know that is what is going to come off to give you your menses or the blood. So because it's thin, you have less cramping, the duration may be shorter, and so you have less pain because you know it's not a lot to expel from the uterus.
Okay, but I saw a tweet. I think it was about 2 days ago, actually. And this girl was saying that she heard that if, she takes birth control, it will like, because I think she have like endo, so it will make her cramps like bearable or like less.
Yeah.
And she said it was a lie because it's the worst she has had since having her period. So is it that it works for some people, but not everybody?
As I said before, initially, everybody's body is different. They might react to, and then the thing is, if that specific birth control is not like helping her pain, she can just probably like go to her doctor. Her doctor will like recommend another one to try, or speak to her pharmacist
like a different
as well.
brand.
Exactly.
Okay.
Because the thing is, like for example, your oral, they have like different ingredients in them. So, like I might say progesterone or estrogen, but they have different types of like progesterone in them. You have different types. Yeah. And they have different concentrations as well, like different doses. So you can try another brand and probably that brand will work for you.
Okay. So the most asked question or assumption is that if you take these contraceptives, it gives you like a body odor and I saw somebody say like a vaginal odor as well. So is that true or...
All right. So contraceptives, it's not a must. It's possible for it to cause a body odor because oral contraceptives can raise the pH of your vagina, and that can lead to overgrowth of certain bacteria, which can lead to an odor. However, when persons are going on birth control, the reason is for them to have like more sex. With more sex, and the sex is going to be unprotected because, they're saying that they're protected, so they're going to have unprotected sex. So therefore, it means that men are going to ejaculate in them, right? Semen does increase pH of the vagina as well. And this can also lead to overgrowth of bacteria. So it's not per se that, it's the birth control causing the odor. It can be the semen. Or if that happens, you have to ensure that the person you're having sex with, they have proper hygiene as well. So it's not necessary that it's the oral contraceptive. It could be, and it could have been a total different problem. It could have probably been like an STI, for example. So the best thing is, if you see something that is persisting for too long, the best thing to do is to see a doctor, and they can make the proper recommendations for you.
Okay.
Yeah.
And another thing is that people say it makes you fat. I don't know if it means like fat or make you like gain weight. Because when I am taking like birth control, because I take Minigan and that's what my doctor prescribed,
which is
for
a
me.
21-day pack.
Yeah, and it works fine. Despite the side effects, which are terrible. But I noticed that I did gain weight, but it wasn't like obvious weight where, somebody would have seen me and say, oh my God, they gained weight. It was weight that I noticed because I was like, no man, but it always like I've on weight, but this look different. So is it like a common thing for contraceptives, oral ones, of course, to make you like just gain weight just so?
Right. So your oral contraceptives, they can cause weight gain. The Depo-Provera, the injection, that can cause weight gain as well. And the implant, and the one that we know here, the Jo-Nelle, that can cause weight gain as well because of the ingredients in them. But the thing is, it's not necessarily always weight gain. It can be water retention. So that's why some persons might see that their breasts look bigger, but it can, after a few months, it can actually go back down. You might, so it's not always weight gain, but it can also be water retention. And hormones can like increase your appetite. So you might be eating more, and that can probably lead to the weight gain.
That not sound safe, cause then me have to just work off the weight. But you know what?
But you just have to like watch what you eat as well. But as I said before, some of it may be water retention. It might go away. But if you're taking it and you know that you're probably eating more, you can like monitor, have a proper diet and just exercise, cause too much exercise is not bad. So yeah.
Okay, so I'm taking the pills to, regulate my hormones, and then I start gaining weight. And let's say it reach a point where the weight just start get weighty, and I'm still taking my pills. Does it become like less effective the more I gain weight?
All right. So first part, if you realize that it's causing you to gain more weight, you can try another one, for example. Okay, so there's a thing now that says that if you're like over 150 to like, or over like 155 pounds, that its efficacy of like the oral contraceptives might decrease. However, it's not something that is practiced to say like, oh, you're overweight, so you can't use the drug, because it's not saying that once you're over a certain weight, you can't use it. It's just saying that there's a possibility that it can decrease its effectiveness, because it's saying that persons with more weight, they have like a higher metabolic rate, and that can make the drug stay less in your body. Less in your body. So, but it's not to say that if you're feeling that it might, or there's a possibility that it might have, it might not work for you, you can go to the doctor and they can provide you something else. Like you can probably try the Depo-Provera, because there's data out that says that the Depo-Provera it's not affected by weight gain per se. Yeah. So you can switch to that if you want.
Oh, so it's not like another method won't work for you if you have on weight. It's just that maybe...
Because remember, as I said before, if something don't work, just try something else. If you feel like something does not work, just try something else. Not say, oh, one not working, that means that nothing at all won't work.
Okay. So let's move on to emergency contraceptives and stuff. I've heard... I'm not even gonna laugh. Right? I've heard that people think that they can use those pills to have an abortion. They can use it to, protect themselves against STIs. Please
clarify.
Clear that up, because the thing is, I've seen commercials on TV and, tell me if I'm wrong, where when they're advertising a birth control, the pill specifically, a new brand, that this doesn't protect against STDs and STIs. And then I was like, people actually take this? So
yeah, they do. So you see, for example, that's why pharmacists have to ask questions. And that's why I say pharmacists have to make judgment calls. So people might come in and think it can protect against that, but it just simply doesn't. So the only thing that the morning after pill, or otherwise known as the emergency contraceptive, can do is that it can probably prevent pregnancy. And I say probably because it's not always that if you take the pill that it will work. In an essence, where if you take the emergency contraceptive, you may already been pregnant, or you've probably ovulated already. And when I say that is because how it works is that the emergency contraceptive, it delays or it stops your ovary from releasing an egg, which is ovulation. So if you already ovulated already, you will, if the sperm, did come inside of you or it was ejaculated inside of you, there's a higher chance of you becoming pregnant, even though you take the pill. Because remember, the egg is there and the sperm is coming, so that's going to do and
then come together and make a baby. But the thing is, I feel like a lot of people need to, read the little packets inside or certain things. And I feel like a pharmacist also tells you as well.
They do.
Because some people think that if they take birth control and the emergency contraceptives, not at the same time, but both of them, then it would in them not get pregnant, but it's it's not 100% as you have said earlier. I think the longer you wait to take the EC, it decreases. So at first it was probably 84, and then let's say you wait another day, it got down to 70 something. And I think the last one is probably 60. And then I'm these chances getting slim and slim by the moment. What am I supposed to do now? Because let's say I take it and I still get pregnant. I just drop down after that. There's, as you said, there's really no guarantee. It's just what you say, people have to be diligent when they're using it. Because you have to, even though you're taking it, you still have to say, okay, there's a possibility that this might still happen. So I'm just going to, prepare for it. So, all right, before you switch on our topic, so let's say, okay, the morning after pill, it doesn't protect you against STIs nor HIV. It can't be used for abortions. The only thing it can do is help you prevent a pregnancy. So it's recommended that you take the morning after pill within 72 hours, right? However, if 72 hours does pass, you can still take it, but it's just that the chances might be slim, right? So usually it's taken at 1 hour now,
and then the other tablet 12 hours after. So if the 72 hours does pass, they tell you to take 2 tablets at once, right?
So when they say slim, what do you mean? Like maga?
Very maga. So basically, in reality, right, there are some studies that will say it can probably be taken up to 5 days, but it's kind of a stretch. Probably 4 days.
5?
Yeah, it can.
Okay.
So if somebody comes in and they're like probably desperate, so based on studies and they say can probably help you, maybe help you. It's very, very slim, but it still probably can. We will allow the person to take it within the 5 days. But if 5 days pass, there's no help because
Just have a prayer.
yeah. So one question that I will probably ask is that if they know that it can cause nausea and that that can probably lead to vomiting. Let me ask you this, right? So you go to a pharmacy, you buy the emergency contraceptive, you take 1 pill, right? And you vomit. What do you do?
Well, the pharmacist said I must come back if I vomit.
Yes, but some people don't know that.
But if I think, isn't it like a pharmacist's duty to explain how to take something effectively?
But then listen, some people feel like, oh, they're being judged, they just want to fast or whatever. You know, like, oh, I know this already.
Okay.
So that is why we're there. Think about it.
So if you vomit and you
within
come
2
back,
hours,
they give you
within 2 hours,
you'll come back for like a new set for it to, because let's say I vomit and me say me not go back to pharmacy and me go back to take the next pill.
Mm-hmm.
And what's gonna happen?
Then honey, you're probably gonna get pregnant.
Wow.
That's why I said come back within the 2 hours, because the drug was in your body long enough to take its effect.
Okay.
So that's why if you want to like reduce like yourself from vomiting, they say usually take it with food. So like even though somebody say, oh, I know that, so one of the questions I might ask is like, have you taken it before? Mm-hmm. And they probably say yes. But even if they say yes, I still say, okay, make sure you know that if you vomit within the 2 hours, you come back to get another dose. Yeah.
Well, I think you're supposed to, but some pharmacists don't explain.
Mm-hmm.
You know, they're like, oh, you took it before? And you're like, yeah. And they're like, okay, all right, so you know what to do later.
Yeah.
But
the thing is, that's why you must ask, because they still might not know. Not everybody knows.
Okay, so how do you take birth control effectively then? Because, you can take it and then you go about your business and you're taking it wrong. I've never seen a wrong way to take, contraceptives.
All right. So basically, if you're starting, they say there's a myth, right? And they say you have to start like on the Sunday. A Sunday? Or probably a Sunday after your period, or just a Sunday. But that's not true. You can really start it anytime you want, right? Mm-hmm. But it's recommended, or because
pull the mic closer to you.
So it's recommended that if you're starting it, one of the best times to start it is on the first day of your period. Mm-hmm. So that means that if you start it, periods probably last on an average 5 to 7 days, right? So after you start taking 5 days to 7 days within your period, that means that once you come off your period, you're immediately protected. So that's why it's one of the best times is to when you're first day of your period. But if you start another time, you're going to have to wait at least 7 days for it to start working. So that's one of the best times to start it. So that means that, once you come off your period, you can have sex if you want, or you'll be protected. But if you start it on any random day, you're going to have to wait at least 7 days for it to work. So effectively take it, right? To answer your question, you're supposed to take it 1 tab per day. I try to take it at the same time each day. So it doesn't have to be specific, to say to the T, 7 o'clock I take it, 7 o'clock I must take it the next day. It can be within a 1 hour, 2 hour period, but I'll just say 1 hour period or so. 1 hour less, 1 hour afterward. Try to take it at the same time.
I don't take it at the same time every day. I'd wake up and take it at 12 o'clock. And then the next day, I take it 9 o'clock in the night. Or 12 o'clock, 12 noon. And then, so it's really when I remember. And I don't see, maybe I don't see anything wrong. Yeah. Maybe, but it's not like I'm doing the deeds to, not be pregnant and stuff like that. I'm really taking it for my health reasons. And I see somebody on Instagram saying that birth control or contraceptives, is playing Russian roulette because you don't know how your body's going to react to, either the pills or the IUD or the injection or anything. But we really need to talk about some of the really mental side effects of it, because when you open the like look a packet, you see this is a thing, and then when you open it out, the paper longbow so. And like half of it is like side effects because like when I was taking my birth control, which I stopped because it was making me like really, really sad.
Yeah.
Like I just want to cry or I just want to off myself. And I thought it was weird because I'm like, I've never thought about these things before. And this girl was saying to me one time that when she was taking this specific, not the one that I take, but another one. A different type. She was having like suicidal thoughts like every day. She just really wanted to like kill herself. I'm gonna say this is like a real life thing. And it's like when I stopped taking it, because I didn't even know it was it at first, but like when I stopped taking it, I felt so much better. I mean, I say, so I have been off it for a couple years. Yeah. Because I was saying to myself, like, it not gonna work. And then I started like a few months ago.
As in a different type?
No, the same one. Oh. And I'm like, Sadoti. So, like.
So why you never like speak to like a doctor or the pharmacist and try a different type? As I said, you know, you can try and switch to see.
No, I was just thinking it was just all of them. So I just thought that, you know, if I that's the thing. Stop,
people feel like it's just the same thing. So.
But I don't really want to take like any other form because I don't know. I've never talked to my doctor about it. Because my doctor said, okay, take the pills and you should be fine. And my doctor sent me on my way. Then I switched doctors and doctors gave like the same pill. Like, you know, I was like, it looked like that pill for me. But, you know, outside of like being sad and like having like a decreased libido.
Yeah.
I don't have anything else. And the weight gain, of course. But like, you know, it feel bad when you have a little babes and, you know, you take a birth control and you want to touch it up and say, and you're just like, get off me. Yeah. Like, because I don't want to have sex with you.
Yeah, birth controls, based on it, the estrogen in them, it causes a mechanism of action, probably detailed, but it causes the testosterone levels to decrease in your body. Because, you know, females have the male hormone in their body as well, testosterone, and that is what causes you to have an increased sex drive or...
Testosterone?
Yeah. Inside
so that's why man always on it.
Probably when you think about it, yeah. So it causes decreased levels of testosterone in your body. So if that's the case, you can try like your IUD or which has progesterone. It doesn't have the estrogen that will decrease the testosterone levels, or you can try the implant as well because implant is progesterone only. So those.
Which one is the implant?
So the implant, right? It's a form of contraceptive where it looks like a little tiny rod or a matchstick stick that is placed inside your arm. It's under the skin.
Them juke it in.
So they make a little, I guess, an incision, you should say, and then they'll place it in, and then it works. So how it works is that it releases the progesterone hormones, and it works the same by like your other contraceptive, where it's either stops ovulation, it decreases the wall of your uterus, so it prevents if an egg was fertilized, it prevents the egg from actually sticking to the wall of the uterus and, you know, developing. Or it can also work by increasing cervical mucus. So what the cervical mucus now does is that it prevents it's like a gooey substance then, and then it prevents the sperm, I should say, from meeting with the egg. So basically, those are 3 ways your birth controls can work, and that's what the implant will help to do as well.
Okay.
Yeah.
But yeah, so back to like the mental health effects.
Yeah, because it's a lot of stuff.
The thing is, it really just makes sense if you abstain, you know, like at this point, because you're putting your body through a lot of things.
Yeah.
But yeah, so the mental health part, you know, so does it like necessarily cause depression? Because like I've seen the ads, I know, when they're moving really fast to the side effects, they're like, may can cause and then you just hear them dropping the depression and suicidal thoughts and make you want to jump off a bridge, and you're just like,
so they're saying that it may because it is a hormone. And you know, right, basically some research will like say, yes, it can cause it. Some research will say, no, there's no correlation to it. But in reality, you know, like we have hormones and they're the reasons why we have mood swings normally. And now you're putting more hormone into your body, synthetic hormones into your body. So it is possible that it precipitates your mood swings. It can cause you to be feeling anxious. It can cause you to feel sad, suicidal thoughts. But there's no there's no like saying that say, oh, it's going to cause it. Like it's a causation. Like it is the reason why, you know? But it's just that it can cause, but there's nothing that says that it will cause it or it's the reason for it. But based on like it is a hormone, they will say like, oh, it can be the reason why you're having or feeling like this.
What if you're already like, anxious, suffer from anxiety, or you're already like, depressed? So taking it, knowing that it's a side effect, can it cause it to get like worse? Or
there is a possibility because it is a hormone and it does affect your body and your mood. Some persons, not everybody. As I said, everybody react different to it. So it's not to say that it will cause. It's not saying that, oh, birth control will cause it. It's that you already have hormones in your body. You're introducing more. So there's a possibility that it can make it worse. But it's not to say that, oh, there is that nothing will say that this is a reason why. But they will say that it's related.
Okay.
Yeah.
That makes sense. So the person that said the Russian roulette, it really is, because like this is really a gamble.
It is.
You take it and you just hope for the best.
Yeah.
I feel like the best, contraceptive method is praying. I don't think it can ever go wrong. We're just praying because remember say when you do your thing and then you start praying, God have your back.
We hope. But yeah.
You have to have faith.
It's true.
Right? You have to have a lot of faith. So a lot of people are saying that they heard that, oral contraceptives can cause like, ovarian and cervical cancer. How like it increases your risk, or sometimes it decreases your risk. Is that like necessarily true? Can, taking it for a long period of time and stuff give you just said no?
No, that's a myth. It's a myth. Because in reality, birth controls are used to birth controls actually decreases your risk of having cervical or uterine cancer and colonal cancer as well. So when people say, oh, it will cause it, no. The only thing is that, if you already have breast cancer or suspected to have breast cancer, they might not recommend it. Let me say they might not. They will not tell you. They will tell you not to take it because the tumors in breast cancer, they grow in response to estrogen in your body. Oh, so that's why they'll say, okay, don't take it because it will worsen your breast cancer. But in reality, birth controls they decrease your risk of getting uterine cancer or ovarian cancer. So there's no fact to say, oh, it will cause it. No, it actually helps you, decreases your risk.
Okay. So a question for me, let's say, children aside, not having kids aside, what are some other reasons why persons would, be on the pill?
Mm-hmm.
Yeah.
All right. So number one, they can be on it for acne because, as I said previously, it helps to decrease the estrogen in your pill will decrease the testosterone levels by a mechanism. Mm-hmm. So that results in decreased testosterone, and the testosterone is what is responsible for acne. Some persons, when they start taking the pill, it can result in them having flare-ups, but that will it should disappear after a while because in reality, it helps acne. Yeah. Mm-hmm. So it can also be used for hirsutism, and that is abnormal growth of hair. And that's seen in females, like when you see them with a beard. Yeah. So it helps to decrease the hair growth because of testosterone. Testosterone is responsible for abnormal hair growth. So it can be used for that. It can be used for PCOS, polycystic ovarian syndrome. It helps you to regulate your period when you're having it. It helps to decrease the pain and the cramps. It can also be used to regulate, if you're just having irregular periods, it can also be used for that.
Okay, so based on your recommendation, like, how soon is too soon, you think, for like a woman to be taking birth control? Like, what's the right recommended age? If like that's a thing.
Okay, so there isn't a recommended age. Mm-hmm. In Jamaica, the law states that if you're over 16 years old, you have the right to get contraceptives if you want. So if you go to the pharmacy and the pharmacy denies your right, they'd basically be in the wrong because you do have a right to go on it. And as you say, there isn't an age limit because it helps with other issues as well. So yeah, there isn't like a recommended age to say, okay, you can't take contraceptives
just
because
vibes.
yeah.
Yeah.
But you're not going to be seen it probably being used in like little children because they don't really have these problems that
Okay,
we'd
so
be
once you
having.
reach like puberty age,
Yeah,
you can
it's
start
usually
looking
around
into
that
it.
age, yeah.
Okay.
And some persons might actually delay using birth controls in like puberty. But yeah.
Do you think that giving like high school children and teenagers, like, well, you have to be a teenager to be in high school. Like, so let me say teenagers, do you think that giving them birth control and, you know, other forms of contraceptives will promote their sexual behavior? Like, you know, would promote them to have sex? Like, professional
Wait, repeat that.
standpoint.
Let me try and understand what you're saying.
Like, exposing them or giving them ample knowledge and actually giving them these like birth control and other contraceptive methods promote them having sex, because a lot of people are under that assumption. So I want to know that from your professional standpoint, you know, making people more aware and more knowledgeable and actually experiencing, you know, contraceptives lead them to have sex.
No, I wouldn't say it lead them, because I just feel like overall in schools we need like proper sex education, because when you go to school, the most you learn about is like your condom, and is that's what you just see. So like when you got older, you're probably just only thinking that the only option out there for you is the condom. If you knew about other options, you'd probably have like better, safer sex practices. You know like how you can prevent a pregnancy if you want, and like it's just something that I feel like should be ingrained in society, to say, let people be knowledgeable about their options, so when they're older they can make better decisions for themselves. So I wouldn't say that it increases it, because, well, in reality though, in Jamaica, children aren't being expected to be having sex. So, and as I said before, if you're in high school, you're probably still within the age range of 17 or 18. When you're 18, you're really an adult. But the law just says that if once you're over 16, you can take the pill. But the thing now is, like, for example, you see a child come in, less than 16 years old, they come in for like an emergency contraceptive. That's where, you have to make decisions, because it could be rape. But the law just states that we cannot give them the emergency contraceptive. That's what the law says. However, it also states that if it's that the 72 hours is coming close, that you can give them, but you still have to refer them to a doctor, and you still have to call the rape unit. So irregardless if you're giving them the pill or not, you still have to call the rape unit or refer them to a doctor or get a parent.
Oh, speaking of like, persons coming into, what's it called? Buy the emergency contraceptive. Why can't men do it? I've heard that like so many times.
Yeah, so...
And if a man goes to buy it, like, him have to call the girl or something like so.
Okay, so if you're buying emergency contraceptive, there are criterias, and the pharmacy does have the right to not sell you or sell you. It's up to their judgment. So some of the criteria is that you have to be a woman to buy it, and you have to be the woman who is getting it. And the reason being is because it's your body, and you know your body best. So, and there are questions that we ask about. For example, I was saying before, they ask you if you're within the 72-hour period. They ask if you've taken it before, and they probably ask you. They should ask you when was your last period. Because as I said before, you might think you need it, and in reality you do not need it, because if you just had a period yesterday and you have sex today, you're not going to need it because you're going to be in a safe period.
Safe period, okay.
Yeah, so really and truly, if you send your boyfriend or your husband to go and buy the pill, they might not know how to answer these questions.
So it's best
and
that
also,
you go in.
yeah, and also you have the issues like you have men who out there that force females to take it, or like if it's in a case where someone is like sexually abusing a child or raping a child, they might give them. So you have issues like that. So.
Okay.
But it's more so for the fact that as females, we know our body, you're the one taking it. We want to advise you properly. You might be on medications that can decrease the effect of your contraceptive as well. So, yeah. who better to answer the question than you, because you are the one taking it.
That's a fact. All right. So, how many times is too many times to be taking emergency contraceptive for the year? Because I heard it's 4, but I just want to, know, and why you can't take it more than a certain amount of time.
So recommendation. So it's recommended that you take at least, use it once in a menstrual cycle. And then once per, it's recommended.
Okay.
You can probably use it more than once you can, but it's recommended that you only use it once per menstrual cycle. So that means that within that 28-day period or however long your menstrual cycle lasts, you only use it once. And then per year, it's recommended that you use it up to 3 to 4 times per year. In reality, you can use it more than the 4. It's recommended 3 to 4 because after frequent using it, they said that it can decrease its effectiveness. And it's more so for the fact that it can cause ectopic pregnancy, which is basically
what I mean.
Yeah, I can explain. Which is basically when the fetus is forming outside the womb. So it's forming outside the uterus, you're going to have like a miscarriage. The baby can't come to term. It usually ends up in a miscarriage. So if you take it too much, it can't. So that's one of the main reasons. If you take it so much times, it can lead to ectopic pregnancies.
Okay, I thought your body just get like used to it, so it just does not work anymore.
So if you do your research, they might say you can use it. They might say its effectiveness does it decrease, but for some people it can. It's possible. There isn't anything to say that it can, but it can because you're using something often, and your body can get used to it. But in reality, one of the main reasons is for the ectopic pregnancy. But there are some stuff that say that it can decrease its effectiveness.
All right, that ain't bad.
Yeah.
So another question I have here, which I find very interesting, is there a contraceptive that helps with cramps but doesn't affect sex drive? Because remember, we're talking about the libido earlier.
Oh, I thought I actually said something about that. But yeah, you can take
you did.
The depot.
Sorry, you can ask for something else.
Yeah, the depot.
Depo-Provera.
The ones that me keep messing it up, but yeah, Depo-Provera.
Listen, I don't pronounce words that I don't know.
But in pharmacy, you have a lot of words that there's a lot of words, so you have to try.
Okay, so what can birth control make your flow heavier? Can it make it lighter? Cause you have, for me, when I take it, my flow is really heavy. Sometimes I say, oh, what is mega dead?
Really? I'm actually shocked because, as I said before, it actually mainly it should help your flow to be actually lighter because, as I said, it's decreasing the thickness of the lining of the uterus. So that would mean that your flow would be lighter, or it might be shorter duration. But it is still possible that
No, I feel like I'm
it is
the
possible,
outside of that.
So that means it does react for you differently then.
Yeah, because my flow is heavy. I get a lot of cramps. If I'm not on it, I don't get cramps at all.
And it causes you to have cramps?
Yeah.
Or because your flow is going to be heavy too. So yeah.
So I'm just when I mean cramp, even my butthole cramps. And I'm just this is insane because before, but then I have irregular periods. So, when it do come, it's just
But when you take
nothing
it, right?
happens.
When you take it, for example, right? Is your flow regular?
Yeah.
As in your menstrual cycle regular? Okay, so at least that's a good thing.
Yeah, I know that's a good thing. And that's why I continue taking it. And I'm all right, cool. And it gives me signs that, it's coming and everything. So I feel like a normal person.
Yeah.
But when I'm not on it, it's just vibes.
Yeah. You don't know when.
I don't know when.
Whenever you
I'm
feel
always on edge.
Yes.
But when it is here, my foot in my cramp up.
Yeah.
I can't, my back hurt.
So you take pills? You take pills to help?
I'm just stuff it out.
Oh, okay.
Because at first I've no, if it's not a pill, but then I realized that maybe pill, because I love pop a pill, if my start hurt me, I'm gone in my cupboard, I'm gonna start at the pill and everything. But for menstrual stuff, I just never really thought of taking the pill. Come and say, it'll be fair. But by the second day, it is not fine. I am dying because the first day is always okay for me.
Yeah.
But so when I reach the second day, it's like me I dead in the show.
Yeah.
And my body just a tear up, and all I can do is just lay down.
I
and
know for
cry.
some people, the first day is usually worse, and then afterwards,
yeah, like
easy.
I hear people say like, the first day is,
the worst.
But I'm like, the first day I'm like jumping up and down. It's like all sunshine and flowers over here, but like the second day, I just bear rain and dark skies.
Mm-hmm.
Yeah, I just want to end everything, and I really, do think that's the cause because before. Everything was fine. But then I see somebody like on Instagram sent in something that said, can it allow for your flow to get heavy on? That's something I can relate to, but you said
it can be. Well, as I said, you react differently to it. It causes yours to be heavy. So it's still possible that it can be heavy.
But can it throw off your menstrual cycle though? So like, you expect like a certain time and then you start to take the pill and then it all come like 3 weeks later. Is that like a thing?
No, it should have been. Let me tell you now. You see, if you don't see your period come within like a certain time frame, that means you're probably pregnant and you should go and take a pregnancy test. Yeah, so even the emergency contraceptive, if you take it, and usually your period will still come within, like, if you expect a period like on a certain day, it might be delayed up to a week. If like 2 weeks pass, 3 weeks pass, yeah, it's time to take a pregnancy test and see if you're pregnant.
I didn't know that you had to see a period after taking like emergency contraceptives. I thought it was just like once you take it, you just do pregnant.
Repeat?
I thought that, if you take EC, then you just don't have to see a period. You just know, say you do pregnant. I didn't know you were supposed to see a period after.
Yeah. Of course, you can still come, but it might be delayed, and it can be delayed up to like a week. Yeah.
Oh,
so it's still supposed to come.
Because like, okay, this is like an honest podcast. I'm gonna just say that.
Mm-hmm.
So because like one time I did take it, and like my partner was saying to me, the period will come, and I'm like, no, it's not supposed to. He's like, what do you mean? It's supposed to. And I'm like, what mean? It's just not there.
Yeah.
And he's like, you're supposed to. I'm like, you don't know what you're talking about. So now that you're saying it's supposed to come.
Yeah, you're not supposed to miss it. If it delays up to more than the week, you can get a pregnancy test. But you did state before that your period kind of irregular. So, you might have thrown off your cycle.
I mean, my period came like a week later.
So see, it did come within like a week later, right?
No, like a week after that conversation. So the conversation was like a week after I took the pill.
It just did like really delayed. But I guess if you say like 3 weeks pass and you see it don't come, then
possible that you might be pregnant.
You could be pregnant. But the thing is, like, vibes. If you take the normal or contraceptive while you're pregnant, it's fine. Yeah, it's not going to harm the baby. And then after a while, you're going to realize that you're pregnant and you can stop taking it.
Yeah.
Yeah.
Vibes. Okay, guys. So, thank you for coming on. If there is like any last words that you want to like leave with them, you can, say it now.
Oh, well, I just want to thank you for having me. Thanks for having me. I enjoyed the conversation. And that's all for now.
Okay, I'm hoping that you guys would have learned that a lot of the myths that you sent in, half of them aren't true, because like every time I ask that question, I just see your face like, girl, that is not true. The most asked question is that it becomes ineffective, and you won't be able to like be pregnant when you get older after like years of using it, and that's not true. It's just vibes.
Yeah, so I hope that will clear up a lot of things for persons.
Yeah. I think so, because I've cleared up a lot of things for myself.
Yeah.
So guys, remember to subscribe to the channel. Leave comments down below of anything you've heard or anything that has been cleared up for you. Tune in next week, when we talk about... No, I'm going to leave it as a surprise. I'm not telling you. Tune in next week. And thanks again for coming on.
Thank you.
Subscribe to Martin's channel. And you can follow me on Instagram at NetsJenner to get more podcast updates. And... vibes. We'll see you next week.